Now for some real-time reaction, Dr. Raywat Deonandan, an epidemiologist at the University of Ottawa. Welcome back.
Thank you for having me.
What's your reaction to that?
I love how you say, welcome, here he is for some real-time reaction, and look at my face as what? My reaction is this was expected. You and I had talked about this a couple of weeks ago, right? That we're going to touch the red, and we are about to do so. And the provincial modeling data that was presented a month ago is accurate. We are exactly where they said we would be. The start of the third wave has begun. The new variants are accelerating. And in fact, the number of new cases, the rise is in parallel with the rise of the new variants, which means this wave is driven entirely by the new variants, which means the traditional mitigation tools of sloppy mask wearing and certain limitations on gatherings are going to be insufficient to quell this. So we have to probably enact some restrictions soon.
Okay, I want to get to what you just said about things being insufficient in a moment, but just quickly on the red zone, we're waiting for the official change. And she was saying that's not really helpful right now. If we can decrease transmission, we should, because we'll have less work to bring it down when red comes into effect. What's your sense of the fact that we're still waiting for the official call?
That's the way these things work administratively. They're going to take their time into making that determination, and it's always reactive. It's always based on what the data says rather than projecting ahead where the data will be, unfortunately. And this, of course, is what I've been saying throughout this entire pandemic. We are cursed with an inability to understand exponential growth. If we don't act early and hard before the worst things happen, we have to act harder later on. So we're probably going to enact restrictions when things get worse, not in time to prevent them from getting worse, if that makes sense to you.
What do you mean about the usual tools being insufficient to bring the numbers down? Why are they insufficient now?
Because B117 is hypertransmissible. So in the UK, they saw exponential growth even during full lockdown. That means that this new variant requires less time, less exposure, a lesser viral load to achieve transmission. So maybe the limits on number of people needs to be brought down. A better quality mask needs to be worn, perhaps even double masking, as Dr. Fauci has been recommending. And we need to really look at ventilation. We haven't been investing sufficiently in ventilation throughout the entirety of this pandemic. Mind you, the weather is getting better. So that opens up some opportunities here. So more outdoor socializing, even outdoor classes, and things like that are now on the table. So there's hope there.
Immediately after we announced this on the air, I got two very conflicting opinions. Let me read them to you because I think you probably hear a lot of this reaction, but it's important to kind of get your sense and to get, I think, your perspective in contrast to what these people are saying. So on the one hand, I've got Tim saying, I just heard your news report about Ottawa possibly going into the red zone. You know what? I couldn't agree with it more. I know over the past 3 to 4 weeks, that Dr. Etches has been issuing Ottawa warnings, and then cases dip for a few days, and then they blip back up, and then they dip down. Let's face it, Ottawa has stopped listening. We need to care. We no longer care. Bring on the red zone, says Tim. Now, on the other hand, Greg is pointing out that we only have 20 people in Ottawa area hospitals, 4 people in the intensive care unit. And he says, we're going into red. Unbelievable. I'm looking at the Ottawa Public Health dashboard right now. It indicates that those numbers are accurate. 20 in hospital, 4 currently in ICU. What would you say to people who are more like Greg, who find this unbelievable and don't understand why it's happening because they think those numbers are low and manageable?
I'll say 2 things. First of all, we don't have a lot of capacity to begin with. And so those numbers are low, but they are scraping our ceiling of capacity. Second is what I said earlier about exponential growth. It explodes uncontrollably, and the human brain has a hard time understanding this, which is why none of us is rich. If we're able to understand exponential growth, we invest earlier with a smaller amount of money and get a bigger bang for a buck. So this has been the bugaboo throughout the entirety of the pandemic, this inability to act early enough to prevent the worst of exponential growth. The fact that we have a smallish number of people in the hospitals is the time to hold it there and not to allow it to grow, because once it grows a couple of people, then that has a doubling time of a certain number of days, and suddenly we're out of control again. Remember, we've only got to do this for a couple more months, probably. This is the last fight in this pandemic, the very last one. When the summer finally comes, we will not see economic restrictions anymore because vaccination will be well underway. All we have to do is just endure this last bit of discomfort to save some lives, save our healthcare system, and we're in the clear.
The B117 coronavirus variant, the one you're talking about being more contagious, and you were saying it requires less time to transmit, less viral load as well. Do masks not work as well, or is it just masks that are poorly worn, that are poorly fitted?
Masks work fine, but we need now better quality masks to make sure we have proper protection.
What do you mean by that? What would a better quality mask constitute?
More thickness. The single layer cloth mask was fine for a while. It slows down the distance travel of droplets, but now we need double layers, possibly triple layers, maybe even more than that. So people have been recommending for a while now wearing two cloth masks, right? Maybe even two cloth masks with different kinds of fibrous content, so you have double the type of protection. And it is uncomfortable. I understand that, but this is what we need to do if we're going to be amongst people. And again, it just has to be done by most people most of the time, so we have a population-level mitigation impact. And I don't expect people to actually go along with this. My lesson throughout the entirety of this pandemic is people are fatigued and compliance will be poor. And so the other solution is, of course, ramping up vaccination. So if you have a chance to get vaccinated, you get vaccinated. Don't delay and don't wait for a better vaccine. Get a shot in your arm because that will help everybody.
On the masks, a 3-layer mask you said is good, maybe even more than 3 layers. What about the disposable ones, the typical blue medical masks? Are those good enough?
I don't think so anymore. I think you probably need 2 of those. Now, I'm not a mask expert. I don't want to speak authoritatively on that. But we're talking here about additional protection just to lower the population level mitigation. What I've read suggests that a single-layer disposable mask probably isn't sufficient for everyday use. To pop into the grocery store, maybe it's fine. But if you're going to be around people for a couple of hours, you need a better quality mask.
So Ottawa is going into the red, according to our medical officer of health, within the next week, whenever the province makes the official call. How long do you think we need to be there?
Ooh, that's a tough call. It's hard to say because I don't know how explosive the rise is going to be. I wouldn't be surprised if it's only 2-3 weeks. It doesn't have to be a number of months. It comes down to the size of the overall wave. Ottawa is just one player in the overall provincial game, and the province is one player of the national game. And this wave is overtaking the entire country, just as it overtakes Europe. So it's a global affair. And it's hard to predict. I'm hopeful that the rate of vaccination globally and locally is sufficient to keep the peak low so that we ride this out faster rather than slowly. But there is no way to know. My gut tells me 2-3 weeks.
2-3 weeks. And you think the red zone restrictions are enough to bring the numbers down?
Yeah, I think they are. I think they are based upon, assuming high compliance. But again, this is not something I study in depth. I could be entirely wrong. Remember, in the UK, full lockdown was insufficient to quell exponential growth. What they had to do was vaccinate at scale. So I think as we ramp up our vaccination schedule, and we are doing that in coordination with the new restrictions, that's what's going to do it for us.
Chatting right now with Dr. Raywat Deonandan, epidemiologist at the University of Ottawa. So we have your reaction now to the fact that it looks like we're going into the red zone within the next week, according to our medical officer of health. You mentioned the third wave. Top scientists are warning that Ontario is now in the third wave. We've got these new numbers from the science advisory table showing the number of cases of variants of concern are going up and that they're steeply rising. What is it that constitutes the third wave? I'm just asking because we've got the Ontario Science Advisory Table saying it's the third wave. We've got the Ontario Hospital Association saying that Ontario's in the third wave. But then there are other people speaking out saying they disagree. Like, for example, Dr. Karim Kurji, who is York's regional medical officer, he said he disagrees. He doesn't think the growth will be explosive enough to constitute a third wave. What's your sense of that?
Well, again, this is a qualitative judgment. There's no obvious definition, a measurable metric for determining what determines the third wave. You don't know if it's happened until it's over. But it looks like it is because we've had steady growth for a number of days, and the growth is in parallel with the growth of the new variants. We're expecting the new variants to be the driver of the third wave, and it looks like that's the case. More accurately, the growth is almost exactly what was predicted by the modeling. And if the modeling is therefore correct, then this is the third wave. So everybody is correct at the same time. No one knows for sure. It just looks like it is. If we look at what happened in Europe is typically 2 or 3 weeks ahead of us. They saw a third wave, and we are lockstep in their trajectory. So it seems likely.
How will using the AstraZeneca vaccine for people under the age of 65 impact our vaccination rollout?
Well, these people have to get vaccinated eventually, and right now they're eager to do so. So that's a good thing. Because we did a good job of vaccinating our long-term care residents and many of our retirement home residents, the demographic has shifted in terms of who was most likely to be hospitalized because of this new wave. It's now the 40 to 79-year-old group. So now that the upper level of that group is getting vaccinated to some extent, that's going to help save some ICU capacity and hopefully some lives as well. But we've only got a few 100,000 doses, right? It's not going to be a huge impact, unfortunately.
Just as this has been announced by Dr. Vera Etches that this is coming, it's an announcement about an announcement, I suppose. We've been talking about plans for a live outdoor event at Lansdowne Park for 100 people. This is at the end of March. Now, it is distanced, and they're trying to make sure that everyone is safe, and there's all sorts of precautions, which we could get into. But do you think that it's safe to be holding an event like that, to be planning an event like that this month as we're going into red?
It's funny, I was asked that question last night, and my first reaction was, oh, of course not. We're entering red zone, and new variants are out there, and it's not the best time. And I still say that it's not the best time. However, I did look at their safety plans, and they're pretty good. You know, they're doing rapid testing, they're doing symptom checks, everyone's a distance, everyone's wearing masks, it's outdoors. I don't anticipate it's going to drive infection noticeably. Having said that, it's a bad look. So from an optic standpoint, it's probably not the best thing to do, but I don't think it's going to be particularly damaging.
Final question to you. We got bogged down by the breaking news on the red zone, but I did want to ask you about retired General Rick Hillier and the fact that he is leaving his position as the head of the vaccination task force. The premier was joking, he's done such a great job. I wish we could shackle him and keep him for a little bit longer, but he said he's done the job that he came for. To that comment, a lot of people responded, has he? Because we just started the vaccination rollout. That's not really finishing the job. Should he stick around? Should we replace him? What's your thought on that?
First of all, I'm not a fan of pointing fingers at individuals, especially not individuals who aren't politicians. So I thank General Hillier for the job that he's done. It's not an easy job. I probably couldn't do it either. But at the same time, I'm glad that possibly this job goes to somebody with more public health credentials. It should go to someone from public health units who has experience rolling out mass immunization campaigns, as many of our medical officers of health do have. So I anticipate that's who it's going to go to now. At first, we kind of thought this job would be a logistics challenge reminiscent of a military campaign. It turns out that's not how they approached it. So maybe a military man was not the best choice for this. It is a public health event, so we need a public health person on top.
Dr. Deonandan, thank you very much for joining us once again on the show. Appreciate it.
Thank you for having me.
Dr. Deonandan, epidemiologist and science communicator.